Yes. I'm Dr. Sunita, a physiotherapist, and then working into women's health and pelvic floor. And I'm every time, I'm treating the patient only related to pelvic floor, and that is specifically women's health. So let me introduce you with very important topic actually, which somewhere was missed in our curriculum. And the name of that area is that topic is pelvic floor. So we are all aware about this pelvic cavity. So this is the pelvic cavity, and as a physio, we can understand this is the pubic symphysis. This is ischium. This is ischial tuberosity. We have this whole ASIS. Then we have this ilium and coccyx. Then we have sacrum and the coccyx at the base. So this is the whole pelvic bone, and we are always taking care of our patient who have issues related to the core. So whenever the word core comes, so core means most of the people, they are assuming the core means only the abdominal area. But the core means central area. Core is a center. So into that center area, abdominal wall is a one part of that core. So that is the anterior wall, which is formed by the abdominal muscles. Now, same way, we have a back area. So back is also part of core. Assume a cylinder or assume one cork can, or you can assume one glass, okay, one bottle in front of you. So in that bottle or that cylinder, you have all the floors. So anteriorly, we are having abdominal muscles. Laterally, we are having all these lateral obliques abdominals, and then you can see posteriorly we have all these paraspinal muscles, multifidus, and then upper side we are having abdominal diaphragm, and downward side we are having pelvic diaphragm, means that's a pelvic floor muscle. So the whole cylinder has anterior, posterior, superior, inferior, and the lateral wall. So that is making the core complete. So whenever we are using this term core, so do not always focus on to abdominals. It is everything compromising. It is kind of composed of everything up down. So do not compromise even a simple and single muscle out of that. So I know that you are very senior. Some of you might be freshers and you have this understanding about core muscles, abdominal muscles, back muscles. You are taking care of the diaphragm as well, abdominal diaphragm. Now today I'm going to give you a little bit more understanding about the pelvic diaphragm. It means the inferior floor of this core. So this is which is missing into the curriculum also, and this is very important because without addressing this muscle, our patient can never get 100% treated. Okay, so so this is what we will try to give you add on into your practice. After going through today's session, you will be able to understand the pelvic floor, their importance as a core muscle, their importance as a back health, their importance with the bladder, bowel, and the sexual health. So everything we'll try to sum up in today's session. So we have people into waiting room, so please keep admitting those people, ma'am. All right. So let's again show you. Let me again show you this pelvic bone. So you all can see that this is the pelvic bone, and inside this pelvic bone, this is the inlet of the pelvis, and you can see the when pelvic cavity is formed by these all walls on the sides. Now, how many cavities are there? If you see into the completely trunk only. So we have this thoracic cavity, then we are having abdominal cavity, and then we are having pelvic cavity. Into thoracic cavity, all this, you can say the heart and the lungs, all respiratory system, those respiratory muscles, bones, rib cage, that is there into the thoracic cavity. Into abdominal cavity, anteriorly, as I say, anteriorly abdominal muscles, lateral obliques, posterior, again are multifidus. So all this abdominal cavity is now kind of rounded and circular by these muscles. And we have a bone, spine is there at the back. Otherwise, it's all internal into the cavity. We have, you can say that all the pelvic all the abdominal organs lying into the abdominal cavity. Same way, when we say that there's another bony framework down, and that is the pelvic bony framework, which is made up with these two ilium, one pubic and one this pubic bone when they are fusing together anteriorly. So this is the pubic symphysis, and posteriorly, when this is now joined with the sacrum, so we can say we have a SI joint, two SI joints. So three kind of connections are there, two SI joint at the back and what at the pubic symphysis. So yes, we are aware about that. So this bony framework is creating a cavity, and into this cavity, three important organs are lying in a female body. Now, the first is, you can say that excretory system, and into this excretory system, think about the kidneys. So kidneys are two things which is doing their filtration, and after that ureters are the tubes which is going downward, and those ureters are attached with the bladder. So kidneys will keep doing their functioning throughout the day, and they will keep sending the urine through the ureters, and that urine is keep coming into that bladder. So this is the organ, very important organ for the excretory system. So this organ will keep collecting the urine. So it is a storage house. So it will keep collecting that whatever urine is coming out from that kidneys. So this organ, bladder, which is a kind of collector. So this is situated into the pelvic cavity. It's most anteriorly into the pelvic cavity. So this is a pelvic organ, first pelvic organ, which is situated just behind your pubic symphysis. So you all can touch your pubic symphysis, and behind that, this organ is situated when the organ is empty. So assume that you have just urinated. So this organ will be like squeezed. After that, it will the surface area will not be so much, not so big. So it will be kind of squeezed collapse organ, which will situated just behind the pubic symphysis. So it will stay into the pelvic cavity. The moment it is keep collecting the urine, the surface area is going to get bigger. And this organ will start expanding like a balloon. So starting from the pelvic cavity, it will keep coming into the abdominal cavity as well. So some of you who have not urinated, you can now touch yourself suprapubically. So the pubic symphysis up to them, one finger, and suprapubically you touch yourself and press. The moment you will press, you will feel the bladder sensation, because that is showing you that the bladder is already filling up and it is expanded into the abdominal cavity. So this is the highly mobile organ which stays into the pelvic cavity when it is empty, and when it start getting filled up with the urine, it start coming into the abdominal cavity, and we can feel it. It will become palpable, and we can feel it into that suprapubically also. So this organ is very important organ, very important part of the excretory system. Now you can understand there's a difference between we and the animals, the cow, the buffaloes. So you can understand that what we are doing, that our bladder is keep collecting the urine, and then we are holding it. And after that, we have some kind of action, nervous control, that we have those kind of training. We are doing we are always had this training in our life that we cannot urinate anywhere. We have a specific places, and onto that specific places we are calling them as a urinal. Only there we are going and we are urinating. So you can understand that we can collect, and whenever that it will be filled up, and it will send a signal to the brain that I'm completely filled. It is a time to empty. So at that time, brain will send the signals, and this you can say internally here, this passage, and one some internal opening is present here downward into that bladder. So now we have one passage attached with the bladder, and the name of this passage is urethra. So normally the urethra of a female body is like a little finger length. It's only 4 centimeters long. So this urethra is attached, it's a passage. Now urethra itself is kind of smooth, it's all made up with the smooth muscles. So it's a smooth organ. So urethra is 5 mm kind of into diameter, and it is collapsed, kind of close all the, it's mostly disclosed. But once the bladder is getting filled up, the filling phase is going on. At that time, the urethra is always closed. But once the bladder wants to the filling capacity is no more into the bladder, and now it will send a signal to the brain. At that time, brain will send a signal to the nervous control to the urethra to relax. So urethra is going to work as an internal sphincter and it will relax. And after that, once the urethra will relax, it means the door is open and urine can start flowing outside. So this is happening mostly whenever our bladder is filled up. Now, out of this urethra, when we talk about this urethra was an internal sphincter, working as an internal door. But out of that, you can see my fingers. So the way I'm holding this urethra is that one muscles which is present around that area. So now this is what is the importance of pelvic floor. So you can see like this is one model where pelvic floor muscles are attached. So I am putting that just behind the pubic symphysis, and you can see the urethra is coming out here by crossing the floor. So it means the floor or the muscles are encircling around the urethra. So these muscles are skeletal muscles. So whenever we are talking about the skeletal muscles, so they have normally three more important functioning, and two type of fibers they are having. One is a slow twitch muscle fibers and one is a fast twitch muscle fibers. Now slow twitch muscle fibers means kind of creating the endurance, sustaining the endurance. It means closing the door. So the door, these muscles are skeletal muscles, and slow twitch muscle fibers are going to close the doors around the urethra. So they will become that urethral sphincters, external urethral sphincters, means external door of the urethra made up by the pelvic floor muscles. And those muscle has a maximum number of slow twitch muscle fibers. Now you understand that whenever brain will send the signal to the body that the bladder is full, then brain will relax the urethra, internal sphincter will relax, and automatically external sphincter will also get a sensation, and that it will also get a command from the CNS, and it will also relax. It means both the door around the urethra will open up and urine will start flowing out. So this is happening in mostly animals. Cow, buffaloes, whenever they are walking, you can say that urine is now like they are keep passing the urine whenever they are walking. Now, the internal and external sphincters are opening at the same time. Same way, if you see we as a people, as a human being, so what happens with the infant, newborn baby? So newborn baby, whenever their bladder is filled up, now their internal and external, means urethra and pelvic floor muscles both open simultaneously and urine comes out. It means that this is a behavior of muscles and brain is controlling. But whenever we are talking about the skeletal muscles, we can train the behavior of the skeletal muscles. The baby, which is 1 day old, 1 week old, 1 month old, might be 3 month old, cannot understand that behavior because their structure is the same like animals. It is not trained, but slowly, whenever the baby will keep growing up, he can understand, she can understand. That understanding is going to give them that toilet training. The mother is going to be that first person in the baby's life, or the family is going to be the first person in baby life, that they are going to show her that not anywhere, everywhere we can pass urine. We have a special places at our house. Even making special sounds when the baby is urinating, the shh, that sounds is going to register in a brain of a baby that, oh, this is a stimuli. Baby is going to register that, oh, I have to urinate when the sound is going to come. The sound of water that is also will become a trigger. And after this sound, so sound is the first trigger, which is going to stimulate the brain that you have to urinate when the sound will come. Sound of water or this kind of shh sound made by the mama. Second is a touch, wet touch. Whenever baby will urinate on the bed and mother will not feel good, and she will show that bad expressions, baby can understand the expression that mama is not happy, and this kind of feeling of wetness baby will also understand. That is going to show her a different kind of visual impact. So this visual which the baby is getting from the mama's behavior, mama's expression whenever she's urinating on the bed will again a trigger, because whenever she's urinating or he's urinating on the bed or on the floor, mama is not happy. But and all the time mama is taking the baby in a some special place, and whenever baby is going to the place by himself, mama is happy. So this is a visual stimulations baby is getting. And after that, slowly when the baby will start getting up, will getting more younger, more grown up, you can understand the baby mother can take the baby, and baby is understanding that I'm always being taken to the washroom and whenever I'm urinating or whenever I'm defecating. So this is a special area into the house. Even same habitual same things we are practicing outside in the society also. So we have a special urinals into malls, shopping malls, markets, and we are always using that areas. So this is again understanding to the brain and training to the baby's brain that we have a special place to urinate. We cannot pass urine here and there. So it means, what is this? We are training their frontal lobe, that visual stimulus. So that is an auditory stimulus, and then by giving them this understanding that urinal is written, toilet is written. So this word is written. So wherever this word is written, that place is a safe for urination and defecation. You can go there, you can pass. You cannot pass anywhere. So this is the special training which we are giving to that we are getting in our life as a human being. And the cow and buffalo, they are not getting the training that we should have a special place to urinate. Same habitual pattern we are giving, we might be giving to our our pets at house. It can be the cat or it can be the dog. We can train their brain also. So that is completely understandable that these muscles are playing a big role, and we can train those muscles, and they are trained socially. Okay, so these muscles, which is skeletal muscles over there, so we have trained those muscles, and it means that till the time urinal will not be there, our external sphincter or outer door will not relax. It means internal door, urethra can be relaxed, but this external door, pelvic floor will not relax. So it will be keep contracting. So the moment the moment the sensation of passing urination will be there, might be internal sphincter is already open, but the pelvic floor will keep contracting till the time you are not into the urinal. So that's a contraction of the pelvic floor. Very important role they are placing in the maintenance of the continence. Whenever you want to hold urine for longer time period, and till the time you are not into the urinal, your pelvic floor will keep contracting and they will maintain the continence, and you will not leak the urine. So very important role they are playing for as a social, when we talk about the as a social animal. So we don't want this muscle that they should be relaxed anytime, and they fail to create this kind of compression around the urethra, and we start leaking into the public or anywhere. So the leakage, this is what is the incontinence, means the muscles fail to maintain the continence. So if you say about the studies that how many of the people they are suffering from incontinence, so try to do this homework in your area. So as per the studies, every 1 out of 3 people, they have an incontinence issues. So it is affecting most of the population. And when incontinence is there, I understand that when we talk about bladder health issue, it's a different term. When we talk about the incontinence, means fail to maintain continence. In this case, pelvic floor is the first important structure which should be trained, which should be addressed. And it means that if 1 out of 3 people have incontinence issues, so 1 out of 3 people need physiotherapy. They need the training of the pelvic floor. And if they need the training of pelvic floor, so now what type of training they need? Is it a muscle training? So what to do with the muscle? So we have to activate the muscle, we have to strengthen the muscle, or we have to relax the muscles. So this is very important concept to understand, and you will be able to understand only after understanding the muscles which is around the area, means pelvic floor muscle. So you can understand how important this bladder health is for us, and how important this pelvic floor is to maintain the bladder health and maintain the continence. We don't want to leak anywhere. And same way, not only the bladder health in this way that they can work as a sphincter and they can hold around the urethra and they can hold us, that bladder, and they can squeeze it and they can maintain the continence. Not only like this, these muscles are helping into the bladder system. Even another system is also which mostly we don't talk more about, and that is the pressure system into the body. So whenever I'm saying the word pressure system, pressure regulation into the system inside, so what is there every time, 24 hours, in our whole life, we are, our lungs are working, our circulatory system is working, and we really need respiration. So respiration system is very important. So this respiration regulation, pelvic floor muscles plays a big role. Now, how it plays actually? So understand this pressure system. The moment you are taking a single inhale, it means whenever the air is coming inside, so what it does, we know that every tissue requires the oxygen. So that is a normally a kind of passive action every time going on. But let me focus on this inhale as an active action. So try to inhale, and what happens whenever you are inhaling, what is happening with your cavities? The first is your thoracic cavity. The moment you are taking inhale, your thorax is moving, it is expanding. Assume your thoracic as a balloon. So you are filling the air inside. The thoracic cavity is going to expand in all the directions, anteriorly, laterally, posteriorly. It means the air is creating a pressure inside the thoracic. Due to this pressure, you can understand your lungs can get the space to expand. They can do their maximum optimal functioning. They can do more consumption of air. They can have more inhale, and that more oxygen can go towards your heart, and that can go to every tissue. So we really need a better inhale, and during this inhale, how the thoracic cavity is maintaining the pressure when the inhale air is there. So expansion of this thoracic cavity. Now, just below the thoracic cavity, when important muscle is present, that is the abdominal diaphragm. The moment you are inhaling the air, what is going on with the abdominal diaphragm? So that diaphragm is the floor. So when the air is going in, the floor, please mute yourself. And please take a pen and paper. Some informations are very important, and you can start giving them to your patient from tomorrow onwards itself. Please mute yourself. Okay, all of you. Thank you so much. The moment you are inhaling, and what happens with your abdominal diaphragm? So your abdominal diaphragm is getting pressurized as a balloon that is getting, filled up with the air. So that is a floor. Abdominal diaphragm is a floor of the balloon. So the more the air will come, the diaphragm will start descending down. So means the floor will move down. So because of the pressure, the moment the floor will move down, the abdominal diaphragm will move down. So what happens? What is going to happen with the pressure which was there into the abdomen? Now, try to come into the abdominal cavity. We understand inhale is creating in a kind of expansion into the thoracic cavity. Same time, descent of the abdominal diaphragm. And now understand what happens here. Your abdominal is also getting filled up with the air. So your abdominal is also getting expand in all the directions, anteriorly, posteriorly, laterally. So that whole pressure system into the abdomen is now moving in all the directions, anterior, posterior, and lateral. So that is very important for the internal structures, because we need more mobility for our abdominal organs also. So they will get good space, because your all cavities are getting expanding, and the internal system will get space, and they will get more mobile, and they will become more functional. And same way, you can say the abdominal pressure is increased in every direction. So after that, what will happen to the pelvic organs? If this upper floor, second floor, this thoracic cavity was having the pressure that moved downward by crossing this floor, abdominal diaphragm, that came into the first floor, that was our abdominal cavity. So this floor got pressurized, and after that pressure, this first floor pressure is going to go into the ground floor. So into the ground floor, who is there? Pelvic organs. So all the pelvic organs are going for kind of compressing down. So if I am a pelvic organ, so when this abdominal compression is going on, the pressure is building up, I will be compressed down because of this pressure. So more organ is moving down. Okay, kind of. And then if I'm a bladder, so I have a urethra. So when I will compress down, urethra will also kind of descend down. So when urethra is descending down, who is around the urethra? Pelvic floor. So what will happen to the pelvic floor? So pelvic floor will also move down, isn't it? So it means everything is relaxing into the body whenever we are inhaling. So this is a pressure system which we have to always understand whenever inhalation is going on. So everything is pressing down, everything is relaxing. You can say that thoracic is relaxing, abdomen is relaxing, pelvic cavity is relaxing, or every organ is getting relaxed, every tissue structures are getting relaxed, and even descent of these both floors. Abdominal diaphragm will also descend down, and the same way the pelvic diaphragm will also descend down. So they will work in the same pressure. So during inhalation, relaxation is going on into the body, and both the diaphragms are descending down. Okay, so this is very important part to understand. Now, what happens? The moment you inhale, the next is exhale. So the moment you are exhaling, you are taking the CO2 out. So what is going on at that time? Your thoracic cavity is compressing, your air is coming out, your diaphragm is moving up, your abdominal contract cavity is also compressing from every side, anterior, posterior, lateral. Same way, your pelvic cavity is also compressing. Your pelvic floor, when they will compress, everything is moving up. So pressure is upward into the body. So during this pressure is going upward, so your pelvic floor will be without any pressure. So pelvic floor will also come a little bit upward. So ascending of the pelvic floor, ascending of the diaphragm, and taking the air out. So this is very important concept we should understand as a physiotherapist whenever we are treating our patient as a core, or as normally also when they have any issues going on into the body. So this pressure system is going to give us a clarity that whenever we are assessing our patient, and if the patient, what is the requirement of the patient. So any patient can be coming to our clinic, whoever has a pain, so might be they are coming for the pain. So the treatment is pain reduction. Second is a very important is a mobility and the strengthening, isn't it? These are the two important concepts: improving the flexibility, improving the tone or action into the muscles. So means any case can be of two types of case. Might be muscle are hypotonus when the tone of the muscles are weak, or might be the muscles are hypertonus when the tone of the muscles are high. So you try to understand whenever someone is having pain and high tone into the body and hypertonicity into the body. So what is going on into the body? Everything is contracting, something contraction is going on. So what is the role here? We have to relax. So whenever you have to relax, and that relaxation is a part of your treatment. So what type of breath you have to focus on? Inhale or exhale? So the simple, if the tension is there into the body, focus on inhale, because the more inhale, more relaxation, internal system pressure is going to relax. So whenever the body is tense and tight, you have to focus on more inhale. Whenever the body is more relaxed, it is kind of, you have to improve the tone. So means whenever you have to improve the tone, because muscles are already weak. So when they are already weak, they are already loose. So in that case, don't focus on inhale. You have to focus on unloading the pressure. So for unloading the pressure, what you have to do, exhale. So all the hypertonus cases focus on more breathing, and all the hypotonus cases focus on more exhale, breathe out. So this is very important concept of the core of this, what we say, the pressure. And this pressure is important not only for thoracic, abdominal, even for the pelvic floor. Okay, and you can understand how beautifully that abdominal diaphragm and the pelvic floor muscles, they are going to help into the pressure. What is important into pelvic floor? As I told you, the pelvic floor muscle has 70% of slow twitch muscle fibers. So when they have a 70% of slow twitch muscle fibers, it means that this floor has more number of fibers, which is responsible for maintaining and sustaining the endurance for a longer time. So yes, we really need those endurance. Now, why we need this endurance? Because these organs are present here. So if this is one organ and it is situated here, so what we want? We want this muscle to completely relax and completely contract? No, we want it more upward, mostly in a maintaining one tone. So that's why this muscle is a hypertoned muscle. Already it is not 50-50, that 50% of slow twitch and 50% of fast twitch. No, it is 70-30. So 70 means more kind of toned as compared, more endurance, more tone as compared to less fast twitch. Okay, and those action is less into pelvic floor. Now we will also come into that which actions are important for fast twitch, but mostly you understand that when the blood is getting filled up, we are not urinating throughout the day. We are this feeling is going on, then we will fill up, the bladder will fill up, and then we'll go for urination. So the frequency of urination is normally is a person is approximately 6 to 8 times. It means that this pelvic floor has to relax only that 6 times or 8 times when you are urinating. Only at that 20-second or 30-second, these muscles are relaxing. Otherwise, they have to again come and they have to do their functioning of contractions and holding and maintaining the endurance. So this is very important area and very important muscles, which has to function, support the organ and maintain this ascending tone around that organ. So means as an organ, I should not descend down. I should be lifted up. So this muscle will have a good tone, good endurance. The organs will be lifted up all the time. So this is very important. Same way, not around the urethra, understand about the passing stool. We have a bowel. So so now I'm coming to the bowel movement. Okay, so I hope you understood that bladder the importance in respect to the pelvic floor and pressure with respect to the pelvic floor. Now let's come to the another very important organ. I'm not telling you about sexual health more here, but the basic thing which is important for everyone, the moment the baby is born and the moment someone is dying, this bowel and bladder is very important for every human being, isn't it? Sexual health is equally important, not that much equally, but it is still has an important part. We will definitely discuss about that. So now let me give you a little bit of clarity about that bowel health. Now what happens? This is you can say rectum. Okay, so this is a rectum, and rectum is the last part of colon. So when we talk about the digestive system, so a little bit of understanding I'm giving you. We have this small intestines doing their absorption of the nutrients. They will send all this excretory system into the large intestines. Into the large intestine, we have an ascending colon, transverse colon, descending colon, and this descending colon is now the last part of the descending colon is now attached with the rectum, upper part of the rectum, and now here stool will start coming and keep like hold the this you can say colon is going to send the stool into that rectum. So these colons are doing this kind of peristalsis movement, and they'll keep moving the stool downward, 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 or might be the gas downward, and that will keep coming and they will keep collecting into the colon, this rectum. And rectum is again a kind of, organ which is like a balloon. Like you can assume a condom inside your body, kind of, structure like a condom inside your body, which can expand. So whatever is feces, if the good food she's eating or high fibrous food is there, it means the stool consistency will be okay and this will be collected. If there will be hard stool, then again for hard stool there might be more kind of in surface area might be required. So that will be again, this rectum will start expanding like this as a balloon and keep collecting the stool, isn't it? So what we are doing, are we keep passing the stool all the time? The answer is no. We are passing the stool once or twice in a day. In mostly it is only once. Otherwise, sometimes it can be two also, depending upon what type of food habits you are having. So this is very important part, which is collecting the stool and responsible for our system, excretory system. Now, stool is hard into nature and it has a weight also. You can say that bladder rectum is like this, situated into our cavity, just following the same shape our sacrum is having. So it is all the way same way. Look, same kind of shape is present. So this is how this organ is the last organ. Last means posterior organ, most posterior organ in our body, and same in male and female. Okay, so this is like that. So you can see this is the coccyx present, and now this is one opening of one canal which is attached with the rectum. So every organ has their canals, the passage. So collection is going on into rectum, but once we want to defecate, after that, one urge will come and will go for defecation, will sit down on the commode, then stool is going to pass through the anal canal. So one canal is attached with the rectum, that is the anal canal. So anal canal and the rectum, the both are smooth organs, and you can say how beautifully they are situated into this pelvic cavity. Now, same anal canal, if I show you in respect to the pelvic floor muscle, so this is where you can understand that role of pelvic floor into bowel health. So now look, this is one opening, posterior opening. This is a coccyx and sacrum. This is a posterior opening. This one. Okay, it's coming out like that. Now let me keep it, place it here. Okay, all right. So this muscle, pelvic floor, is supporting that organ. So this is a kind of supportive role of the pelvic floor. That organs are situated, so supported by the pelvic floor, and their canals are passing through the pelvic floor. So means if canals are passing, muscle has to do some action around the canals, which can compress and relax. Compress and relax means it's going to work as a door. Door means one door is this internal organ itself is going to behave as a door. So this organ is anal canal is the internal sphincter, and the pelvic floor is the external sphincter. Now let me just keep it like that. If this external sphincter is coming out, you can see that this is how beautifully this muscles, the deeper layer of pelvic floor muscles, it is coming out from. Now this is another part which is still remained. So that will be again supported by extra layer of pelvic floor. So I'm keeping this layer over here, and you can see that this is that external muscles around the whole anal canal. So normally anal canal length is 3.5 centimeter long. So that 3.5 centimeter or 3 to 3.5, so that length is completely covered by the pelvic floor. So it means that if this whole pen was rectum and this downward part was anal canal, so this anal canal is completely covered by the pelvic floor. So this is the pelvic floor. So kind of a complete closing. Now, two things are going on. Double roll. What is double roll? You can understand stool has a weight, and we don't want the stool to come out automatically anytime. So for that, internal organs, this anus should have some kind of properties, kind of internal structures which can create a compression, automatically compression. So that's how we have an internal, some kind of bacterial lines, some different type of structures made up with this, this anal canal is made up with some different type of structure. So which is kind of all the time collapse with each other. So if this is the anal canal, So this will be kind of closed. And due to this closing, the closing is more squeezed, more hard into the central part. So if this is anal canal, the center here, some kind of, arrangements are there. As arrangement means you can understand. If this is whole canal coming from here to down, so this middle part of that will have some kind of ridges. So you can see if this is from here and from here all the way, okay? If I'm creating this anal canal, so can you see the center? This is the ridges. So into the ridges, this is a fit from each other. One finger is getting fit with the other finger. So that kind of arrangements are there into the center of the anal canal. On this area, we are calling is the pectineal lines. So it means kind of more closing. And due to this kind of formations of the tissues, you can understand that when they are collapsed completely, so nothing can come from out to down and from down to up. So it means they are going to maintain some different pressure system into the anal canal. So anal canal, anal pressure is always high into the anal area. It's kind of high anal pressure we required there. And that anal pressure is only possible when these ridges are strong. The internal structures are strong. It means the organ should be strong all the time. So organ is strong enough, it has a ridges, and it will only open, this ridges will only open, or this canal will only open when the CNS will send this signal that you open up. Then only it will relax, and then the stool can start descending down. It means when they will relax, the anal pressure will now go down, and then the stool can start going out. But the moment, till the time brain is not sending this command, this ridges will be always compressed. And due to this compression, there will be always higher pressure into the anal, upward pressure. So instead of downward pressure into the anus, there will be upward pressure inside the anus. It means the door through which the stool has to pass, that is also creating the upward pressure. And due to this upward pressure, stool will be moved up. We don't want the stool to come into the anal canal and create that kind of stimulation to the nerves. So this upward pressure is very important into the anal canal, and that is possible only with the good anal sphincter. If anal health is good, the passage is good, there's no damage to the vessel. Okay, please mute yourself. If you're not talking with me, please mute yourself. Otherwise, it will be disturbance in between. Understood? So this is the internal anal sphincter we are talking about. So how beautifully the God has created this storage passage, and they are kind of, you can understand they're managing the canals. So canals health is very good. They are compressing. Due to the compression, upward anal pressure is always high. This upward pressure is doing two work. Not only one work, two work. One is it is compressing, pushing the stool upward because the pressure is from the down. So I will be always moved up instead of going down. Okay. So this is the one important part. The stool can't come down. And the second is very important is that is upward pressure is important for the veins. You can understand every part of our body. We have arteries going on and veins are taking blood back towards the heart. The veins are also there. So what is and this complete vascular system. So what happens? These two systems are there. Arteries will bring the blood, the tissues, and the tissues will get that vascularity, and after that, from there, the veins are going to take the deoxygenated blood back towards that heart. So now you can understand it downward. If this is the passage, so what we want, we need some kind of compression over that area, which can create a compression over the veins, and venous return can be facilitated. If the more anal pressure will be there, good anal pressure will be there, that is going to create a pressure over the veins, and veins can take the blood back towards the heart. So this is very important facilitation for the circulation. So where these internal sphincters muscles are creating a good role. But the moment this anal pressure is weak, so they cannot apply upward pressure, so the veins will not get compressed, and the venous return will slow down. And what will happen? That is going to, now the blood which was there in the veins, that blood is going to stay there, and might be slowly the blood will stay for longer time. And if there is no pressure inside the anus, now there is, second is, we really need that something which is strong enough to create a compression over the system. So two supports are there. One is the anus itself, their behavior, and second is on the top of that pelvic floor muscles. If this was anus, this is pelvic floor. So if the finger has to do its work, but I should also do work. So two works, two doors. So internal sphincter has to be powerful, as well as the external sphincter should be also powerful. In any case, any situations, when one system is getting failed, other can help. But we don't want one to get failed. We want both of them strong enough. Then only we can maintain the continuance. Okay, so this is internal sphincter, and this is the external pelvic floor muscle. The whole length is kind of circulated by the muscles, and these are the pelvic floor muscles. So what they will do, the good pelvic floor muscle, which has high number of slow twitch muscle fiber, they will create a sustained compression. Due to this sustained compression, that you can say the area will be compressed. That is going to enhance this internal air pressure. So you can understand these pelvic floor muscles are going to help in facilitating that air, maintaining the air pressure upward, as well as this venous return. So more stronger external anal sphincter muscles, more better venous return from the pelvic area, anal area. So if you can understand, if these pelvic floor muscles will not have strength, they can't squeeze, they can't maintain the squeeze. So the internal pressure will be all go into that anal area, internal sphincters. They have to try to hold that, because I'm not getting support from outside. So I have to do all the work. On a longer run, I might also get weak. So in this way, what can happen with the veins? Vein cannot get compressed completely because one system is failed or both system is failed. When they can't compress, so the vein will start accumulating the blood inside, and they might start becoming bigger, enlarged. And when they will become enlarged, this is what is the piles or hemorrhoids. And patient can show you hemorrhoid or piles. So why the patient, it can be internal hemorrhoid, external hemorrhoids, why they are happening? They are happening because this internal pressure around the anus, it can be the anus is weak, internal sphincters are weak, or definitely the external sphincters are completely weak. Then only the hemorrhoids are visible inside the area, anal area. So you can understand that if this, so this is one part, the hemorrhoid and piles can happen if these muscles are kind of, very weak. So they can't generate the upward pressure. The second, if these muscles are not strong enough, so what can happen? That stool leakage, gas leakage, that can be very common. And is it the leakage of stool is a kind of good? The answer is no. 50% of geriatric population, they have stool issues after a certain age. You understand the female body. Our body is mostly depending upon the hormones. When they're maintaining the tone of the anus, urethra. So whenever this estrogen is not there in our life, when there's a kind of no periods after menopause, so the tone will not be strong enough. So we really want that whenever the internal tissue, internal sphincter tone is going to go down, at least the muscles should do their work. We can we can do the strengthening of bicep at any age. We can at the age of 70 also, the biceps can be trained. Same way, the skeletal, because it's made of skeletal muscles. So skeletal muscles can be trained anytime. We know the same, it will not do the same work, but still we can keep working onto the skeletal muscles throughout our life. So the tone of this muscle we can always increase. And why to let those people suffer who are suffering from these issues already, and we are going towards that age. If I'm 44 today, one day I have to be 65, one day I have to be 75, might be 85. So do I want to leak? The answer is no. So it is very important that I want to prevent those kind of issues, those kind of conditions in my life. So I try to maintain the strength, try to build the strength, not maintain, even try to increase my strength. So that is very important. This pelvic floor muscle should have a good strength. to hold that stool. So this is one aspect of our bowel health, that it helps in maintaining the fecal continence. So if this muscle will be weak, this a person can have a fecal incontinence, gas, flatulence, or piles or hemorrhoids. Not only this is the second important role of this muscle which they are doing with that bowel health. Not only that, you try to understand that these muscles are coming from they're coming from everywhere from this pelvic cavity. So assume that this one and this one. So what is the difference? So look at the pubic symphysis over here. This muscle is starting and going at the coccyx. From pubic symphysis all the way up to the coccyx. They are creating the floor. So the room where you are sitting, this wall to that wall, anterior to posterior wall, okay? The floor is attached. So from pubic symphysis to the coccyx. So origin is coming from the pubic symphysis, and the muscles are inserted into the coccyx over here. So the coccyx is the last, bone, tailbone. So into the tailbone, if this is a coccyx, and this coccyx over here, these muscles are attached like that. If look, from pubic symphysis to the coccyx. So what they are doing actually, they are maintaining the stability between the pubic symphysis and the coccyx. If the muscle has a good tone, the stability will be maintained. If the muscle will be weak, loose muscle. So what will happen? They will not be able to pull the coccyx anteriorly, because this pulling always, we need this kind of concavity anteriorly. So if the muscles are strong, then only they can attach here and they can keep pulling, maintaining its this kind of angle over here, this kind of shape. If muscle has a strength, then only they can pull it anteriorly. Not too much of pull, kind of still their pull is there. So now if you want to feel it with me right now, so you might be knowing that squeeze your pelvic floor. If this is okay for you, so I'm giving you the command, squeeze your pelvic floor and feel what going on with your coccyx. You will feel that your coccyx is moving anteriorly, or might be hold your gas. So the moment you will hold your gas, you can feel the coccyx is moving anteriorly. So this movement, upward movement is coming from these muscles, which is pulling the coccyx anteriorly. So this is an upward pull, extra pull, which we can feel when we are doing that kind of action voluntarily. But normally, our coccyx is always pulled anteriorly, because if the muscle has a good strength, they will keep pulling it anteriorly. But if the muscles will be loose, so and this anterior pull is going to create an ascending pressure also, ascending upward over the pelvic area. So pelvic organs will not descend, because this kind of pull means some kind of action, and this action means upward inward action. So organ will get a help like a trampoline. So how the trampoline is creating upward pressure, same with this kind of one hammock kind of things these pelvic muscles are doing. So if this hammock, which is coming from one part to other part, if this hammock is not strong, it is descending. So what it will do? It will fail to pull the coccyx, maintain the position of the coccyx, and this anterior, kind of compression over the coccyx. So what will happen to the coccyx? Coccyx can start changing its position. Instead of this concave, it can go like that. Okay, it can fall backward. And whenever the coccyx can, because someone which was holding it anteriorly, it can't hold it, it is weak, so it can start pulling like might be a little bit down. And this little bit down is going to change the whole position of your sacrum. So try to understand the sacrum. Sacrum is, now we know that it's a fused bone. S1, S2, S3, S4. Now, but still we have this counter nutation. So it's all the time this kind of position is there. Upward is anteriorly flexed, and downward is externally extended like this. Okay, so downward S3, S4 is extended, and S1, S2 is flexed. So this position is very important. And downward part over here is coccyx. Now, who is maintaining somewhere this position? This pelvic floor. The moment the pelvic floor will fail to pull it, so what will happen? This can go down. If this can fall down, this is the coccygemia. So the moment this will fall down, so patient will sit on the floor and the pocky pain. So this pocky pain, it can be because of the weak pelvic floor. So coccydynia reason can be pelvic floor. So what pelvic floor? Weak pelvic floor. It is not able to pull it anteriorly. That's why it is falling back. So when it is falling back, it is giving sitting pain to the patient. So this is very important concept. And the moment it will go back, so what can happen to the S1, S2? It can come for more fraction, the narrowing of the inlet. So the more it will come anteriorly, and S2, S3 can go more outward. So more sacral pain patient can show you, more sacral pain, and as well as SI joint pain. The muscles which is attached here, they will be all tensed and tender and overstrained because there's a kind of mild positioning. Internal inlet will be narrow due to slight movement shift of the sacrum. Okay, so this can show tension around the back and SI or as sacrum and as well as sacral pain as well as the coccydynia and the weak pelvic floor. So next time, whenever your patient is showing you pelvic back health issues, this is a back and the pelvic floor relationship. So you can understand if the sacrum will move little bit anteriorly. So what will happen to the air pressure? So a balloon was every side it has to expand, but this balloon can't expand posteriorly because the sacrum is always putting it more pressure from the bound. So this chair is putting me pressure anteriorly over me. So the air pressure will come anteriorly. So there's going to create a shift into the air pressure inside the core. So the sacrum will move like this. Pressure will go more anteriorly and laterally. So lateral muscles will start getting weaker. Transverse abdominis, that will start getting, that is kind of, like a corset. So these muscles will lateral pressure, mild lateral pressure will start getting increased, and this transverse muscles, external internal obliques, they will be over weak. And that is a kind of, this sacrum can start creating these issues, and pressure will be more anteriorly shift. And that can give lordosis to the patient also, anterior pelvic tilting to the patient also that can cause, and it can on the longer run can create more anterior pressure, which can put a strain or rectus abdominis, and diastasis recti can also happen. So this is all kind of, related to each other. Just a simple weak pelvic floor has created the change into the spine and the pressure anteriorly. You can say anterior pelvic tilting, more loading on linea alba, might be diastasis recti. So you can understand not only that, the diastasis recti, when we say the abdominal muscles, rectal muscles, abdominal muscles are transverse abdominis, they are coming from xiphoid to downward. So xiphoid means lower part of the sternum on the sides. So from there it is going, so these are the two muscles. If they will go down, and if pressure is there, so they can the epineural. So this is now coming together with this connective tissue. We are calling it the epinosis also, linea alba. So more pressure is there onto the center, they can start expanding, going away, might be one finger, two finger away. So if they are going away, try to think what on a severe cases, what can happen when the diastasis recti is more than 1.5. People are saying 2-finger diastasis recti is okay. I'm not saying it is okay, because understand what happens, what this rectus abdominal muscle is doing. It is coming from up to down, 2 layers like that. And these muscles are strong. So and like the pelvic floor, they have a hypertone. Rectus abdominis muscle is also hypertone. Okay. So these muscles are always together and it has a hypertone. So due to this hypertone, it can sustain this internal pressure, more internal pressure. We want this internal pressure all the time from the abdomen, because this internal pressure is going to put pressure over that vena cava, and they can take blood back towards that hurt. Just to facilitate the venous return, we really need a good, strong rectus abdominis muscle, which can always create a kind of this kind of hyper contractions. We don't want too much of contraction, but we want tone muscle, not tone, hypertone. So muscle quality or property is already there, which is made up like a little bit of hypertone as compared to other muscles. So this hypertone is important for facilitating this venous return. So if this tone is required, so understand 1 finger, 2 finger is normal. No, it is not normal, because 1 or 2 finger can also create a distance. Whenever distance is there, there will be load over the central connective tissue. And there are high possibility that this internal pressure will not be maintained that strongly, which should be. If strong muscles are there, they can maintain internal pressure. But if there's a space between them, it can be one or two fingers, they can't compress internally. So they can't help into the venous return. So again, that can be the circulatory property of the body can be hampered. So these muscles, which is coming from the xiphoid, if they are separated, so you can understand the xiphoid from there can also start going kind of moving that rib cage on the outward side. So rib cage, the last rib, which is, you can say, central and the last. So there might be, what will happen in this case? Understand, if I can't compress the air centrally, I can't maintain the air into the center. So center of gravity can come anteriorly. So shift of the center of gravity can be more anterior instead of the center of the body, because you can say this pressure, there's more space there. Anteriorly, we have more space. So center of gravity can shift anteriorly, and this can change the whole body system. Okay, so we don't want that. And the space can also be there. And you can say the ribs, even now, okay, what I wanted to tell here, which I should not miss it. In this case, the air that rectus abdominis can't compress the air posteriorly, okay, because they don't have the tone to compress it. So air or the pressure will be more anteriorly, which is going to create more weakness of the abdominal muscles, and they might be fail to create a contractions. And we want these abdominal muscles contractions for the venous return. We want this abdominal muscle contraction for defecation also. Whenever we are passing stool, you might have try to feel tomorrow when you pass stool. Whenever you pass stool, your stool is coming out, your abdominal muscles are contracting. They are working as an antagonist on that particular situation when you are defecating. So this kind of contraction is going to put compression over the large intestines. They will compress and they are going to move, and hence the gut health, more facilitation of that stool. So if this abdominal muscles are weak, patient can show you constipation and not passing stool for longer time period, blotting, abdominal blotting, gastritis, those kind of situations can be there in patient's life. So this is very important concept to understand. The air, we want kind of this kind of isometric contractions or this kind of tone of of these abdominal muscles. But weaker pelvic floor can change that back health, can change that lateral muscles, can change the rectus muscles, and can create abdominal diastasis, and can change the air pressure, can create separation of, you can say that, both these two muscles, and can lead to air coming more inside that can give loading over this, what we can say, infrasternal angle. You might have heard about your last, what we say is the rib cage. So last rib cage, so one side of rib cage and other side of rib cage, they both are going towards the xiphoid. So they are maintaining one angle. So when everything is fine, this angle will be 90 degree. But once this anterior structure is widened, so this angle can start getting wider. So infrasternal angle, the angle below the sternum, will start getting bigger. We are calling it the infrasternal angle, IS angle. So in these cases, the angle can change. Instead of 90 degree, it can become 100, 110, 120. So wider infrasternal angle. So what is going on with the rib cage? Rib cage are going on this side. So it means the ribs are changing. It's rib flare is going on. So if the rib flare will go, what will happen with the diaphragm? Diaphragm will descend down, isn't it? Because ribs are going like this and diaphragm is attached with that. So it can descend down. So if the diaphragm will descend down, so where is pressure? So whole pressure system is changed into the body. The pressure will be always downward. So downward like this, because the descended diaphragm. And due to this descending diaphragm, you can understand, always descending diaphragm, and the pressure will be more laterally into the body, anterior and lateral, and pressure will not go in the back, and more posterior chain will become tensed and tight, and anterior chain of the body will become weak and loaded. So you can understand the whole system will get affected. Only, and I'm not saying only pelvic floor can create it. Anything from the core can create the other system, can affect the other system. If diaphragm, if rib cage is extended, it can create downward pressure. It can affect the pelvic floor and the whole abdomen or the back. If the back health is an issue, it can affect the whole core. If the abdominal diastasis recti health is an issue, then it can affect the back and upper and down. If the pelvic floor is an issue, it can affect the. So we cannot treat the symptom. That one symptom, okay, DR we are treating, or back we are treating, or breathing we are treating, or we are pelvic floor we are treating. No, we cannot treat a symptom. We have to look for the system change, how it is affecting the system. And as a system, you try to understand. So I know that you are good enough, experienced enough with your abdominal diaphragm, abdominal diaphragm, abdominal muscles of the back. But equally important is the pelvic floor. Do not miss. They are all correlated. So that was that relationship between the back, the core, and the pelvic floor. Very important. You might have heard, like I've already explained you about this pelvic bowel health and sexual health, bowel health and the bladder health and the back health and the pressure system. Now let me, so far, I'm just keep telling you about pelvic floor. So now let's understand the pelvic floor. Okay, before forgetting another important system which is present in a female body, that is the reproductive system internally, like this. So we have a uterus present with 2 ovaries, and this is vaginal canal. So you can say the centrally, which organ is present into the center of the pelvic cavity. So let me just put it here. Anteriorly, pubic bladder. Then middle we are having vagina coming. If you see the vestibule, urethra is there, and then after that vagina is there, and after that anus is there, isn't it? We are all knowing it. So these are the 3 important organs which is situated into the abdominal pelvic cavity of a female. Like this. Bladder, uterus into abdomen, then and the pelvic cavity also. And then we have rectum, the posterior rectum. So these are the 3 organs. So bladder health, bowel health, and reproductive health. I will not use the word sexual health. I will use the word reproductive health in a female body. So what happens that this reproductive system is coming from, sorry guys. This reproductive system is having one canal. Reproductive system means ovaries. Ovaries are primary reproductive organ. Then uterus. Uterus has a cervix. Cervix is coming into the vagina. Vagina is a canal, like urethra was a canal responsible for all the excretory, whatever is coming from the urine, bladder, urine can come out from the passage. So that was a passage for urethra was the passage for bladder. Anus was the passage for rectum. Vagina is the passage for uterus functioning. So whatever is going on in the uterus, vagina has to help that. It's a part of reproductive system. Canal. So 3 canals are there. Now, when we say reproductive system, every time we have periods going on, like starting from the menarche to the menopause, periods are very important for us. So periods has to come through this, and they are liquid into nature. No? Blood is there, liquid into kind of lumpy sometimes. So that can all the time can come through the vagina, and you can say over here, this vagina is crossing from the pelvic floor. So muscles are present around that, and then we can collect that menstrual blood into that condoms. Now, assume the female nowadays, they're not only collecting their blood into not condoms, sorry, the sanitary pads. So they're not only using the pad. Nowadays, girls are, assume that they are going for swimming sometimes. And if they are having periods, they might don't, they need, nowadays, another things are there into the system is tampons or cups, menstrual cup. So what the girls are doing, they are, so I have one cup here. Okay, so this is a menstrual cup. So this cup, they are inserting inside the vagina. They will insert and they will just insert like that. And this, they are going to collect. Now, this will be inside the vagina, and they can do, they are free for going for swimming and whatever they can do. And this cup will keep collecting that blood straight away from the cervix only, because the suction is there of this cup with the cervix, and they can collect the blood. And after that, they can take this out, and they can empty it again, they can insert it. And they are saying that they're not using it, is more cost friendly and things like that also, but they are inserting it. It means whenever you want to come inside that vagina, so you have to cross the door. So this is the door around the vagina, made by some muscles. So these are some bulbocavernosus muscle. Then middle layer we have, again this is a door, some muscles around that vagina. Then this is again muscles around the vagina. If these muscles are okay, you can relax, insert something, and you can, you can say that you can insert the tampon, you can insert the cups, or you can do the sexual activity. If these muscles are relaxed, you can go inside. They will allow you to penetrate. They will allow you to come inside. So that is the first door around the vagina. So for penetration also, for sexual activity also, or for fertility also, if I want to become mother, I want to be mom, so this penis has to come inside the vagina, and the penis will ejaculate near the cervix, and sperm can travel towards that fallopian tubes. I can be mama. But if these muscles, the door is very tight, it is very tight, so the penis can't come inside. So this is, the entry is closed. When the entry is closed, you can't go. Gynecological exam can be painful, finger insertion can be painful, tampon insertion can be painful, not able to put cup inside, or not able to have intercourse. And this female can't have a sperm on a natural way, and she can't get pregnant in a natural way. So this, we can say the muscles around the vagina got spasmodic, or they have a spasm. So this condition is a vaginismus. So many of female are suffering from these conditions. These muscles are tense, they are hypertoned. If they are hypertoned, vaginismus can be there. In India, approximately 17% of female have vaginismus. In recent study, 2024, one paper has been published from Madras, and 36, as per one clinic research, 36% female, they have vaginismus. It's a kind of very big data nowadays. The female don't have those relaxed muscles around that area. 36 is a big number in India, the youth. So it means that 36% females, or might be as per the old study, 17 to 36%, they need physiotherapists. They need the physiotherapist who is trained into pelvic floor, the physiotherapist who has an understanding of these muscles and who know that how to relax these muscles, that they can help that kind of big population. So patients are there. 1 out of 3 female, they have urine leakage. 1 out of, like, I'm not saying so many of people are having fecal incontinence issues, but so many females are having issues, you can say sexual pain. 40 to 50% of female, they have a sexual pain. So every other girl walking on the street, she might require pelvic rehab therapist. So it is pelvic rehab therapy. It is very important for us to understand this muscle as a physio, because this is a muscle and we are that expert of muscles. Okay, so understand this muscle. Understanding is going to help people suffering from back health, bowel health, sexual health, bladder health, and even the whole body maintenance, the system maintenance. It is very important. So that is an important part of the sexual health. If these muscles are weak around the vagina, if these muscles are weak, you might have heard about prolapse. Organs are coming down. Cystocele, rectocele, utrocele. There can be so many different types of organ prolapse can happen. Okay, 80% of people, they have piles or hemorrhoids. 80% of mothers, they have piles and hemorrhoids. And yeah, so many of people you can help, but you have to understand pelvic floor. So far in our session, I told you what is the importance of pelvic floor muscle. Now let me tell you what is pelvic floor muscle. How many muscles are present into this floor? So Is it one muscle or is it a network of muscle? How many layers? Okay, so one by one. When we talk about these muscles, as I told you, that complete floor is kind of made up with this muscle, complete floor. Okay, outside also. Now let's understand the whole system. So just to understand this whole system, four bony landmarks is important. First is the pubic symphysis. So this is the pubic symphysis. So don't think about pubic symphysis as a whole pubic symphysis like this. Think of pubic as a pubic symphysis, superior tubercle, superior part and inferior part. Now from here, inferior part over or anterior, this is anterior and this is the posterior part of pubic symphysis. The whole bone. So if this chair is the bone, so this is the one part, this is the outward, this is upward, this is downward. So superior, inferior, and you can say that anterior and posterior. Everything. From every part, muscles are coming. Muscles are not coming from superior here, but muscles are coming from inferior here. This inferior tubercles, muscles are coming from here or might be coming into that area. So this is another bone on the side. Muscles is also not coming from inferior tubercle. They are coming this posterior side here. Muscles are pubic symphysis. From the posterior part, muscles are coming, pelvic floor muscle. Now here, what is there? Ischial bone. You have this ischium and pubic rami. This is ischium and going down ischial tuberosities. So this is very important landmark. So pubic is one anteriorly. On one side, you can say one ischial tuberosity. Other side, other ischial tuberosity, and back at the we are having coccyx. So coccyx and both ischial tuberosity and pubic symphysis. These are the four bony landmarks. Very important. From there only the muscles are coming. Now, these muscles are arranged into three layers. It means there are three floors. Outer floor, we are calling it as a superficial because it is more outermost. So superficial floor, superficial layer. Then middle floor, middle layer. Deeper floor, deeper layer. Okay. So three layers are present. Muscles are present into three layers. Superficial layer, middle layer, and deeper layer. You might have heard about levator ani. So levator ani is a part of deeper layer, more inside the body. If you want to touch the levator ani, if you want to palpate the levator ani, you have to go with the transvaginal approach, transrectal approach. So they are the more deeper. So go inside. From the vagina, go inside. From the rectum. So transvaginal, transrectal is important for the deeper layer, palpation, assessment, treatment. Okay. And outer, if you say that these muscles, superficial, more externally is a superficial. So you don't have to, just to treat the superficial, you don't have to go transvaginal. You can just treat the door externally also. So vulvar approach, you have to do external vulvar observation, vulvar palpation. No, don't go inside. You treat externally only. Okay, assume that you are standing in front of the door, someone's house. Outside you are standing. So from outside you can see outdoor. So outdoor you can touch from external. If you want to come inside this room, you have to come inside. So this is the internal levator ani. So this way muscles are having a different layer and every layer has a different approach of the treatment. Okay, so let's talk about the first important muscle, superficial muscles, and how many first important layer, superficial layer, and how many muscles are present in the superficial, and every muscle individual functioning. So this is what we have understood so far, the whole core, pelvic organ, bone, inlet. There are some ligaments, and these are the organs in a female body. Bladder, uterus, rectum, anterior posterior pubic symphysis, posterior sacrum. These are the urethra, vaginal canal, anal canal, and these are two organs in a male body. Every organ is passing, every canal is passing through the pelvic floor. So these are the pelvic floor muscles. Now let me just go through this one. So this layer is the outermost layer, superficial layer of the pelvic floor. Now now I'm using the pen, different color. Let me use a different color pen. Okay. So pubic symphysis is anteriorly, coccyx posteriorly, ischial tuberosity is on the side. So now let's understand. There's no first and second muscle. We are just taking it as a first. I'm just telling you, okay, let's just start with the one muscle here. Inside the center here, we are calling it as a perineal body. It's a central part. So from this anterior to posterior, lateral to central, one central part is there, is a perineal body. So when we are seeing, looking at this whole structure, can you see that, can we form a diamond? Can you see a diamond shape structure? If you just draw a straight line from here to one ischial tuberosity, other ischial tuberosity, other coccyx, ischial tuberosity, and again go up. Can you see this diamond? Yes. So this is how we are calling that pelvic floor muscle is a diamond shaped muscle. Now you can divide these muscles or these diamond, understand your body as a right and left. So starting from pubic symphysis and draw a straight line, go up to the coccyx. And you can say that this diamond can be divided into two halves. Right side of the muscles and left side of the muscle. Whole body has right and left side muscles, starting from head to toe. Same way, pelvic floor is also right and left side muscle. So this is one side of bulbo, this is one side, other side of bulbo. This is one side of ischio, this is the other side of ischio. So right and left side of muscles. Okay. Same way, we can also, if you want to draw one straight line, one ischial tuberosity to other ischial tuberosity, you can also divide it, this diamond, as an anterior part and the posterior part. Anterior means above than that. So above than the ischial tuberosity and posterior to the ischial tuberosity. So above than the ischial tuberosity, two structures are present, urethra and genital. Vagina and the clitoris is a sexual, is a genital. Or vulva, these are labia majora minor, they are all external genitals. So all these external genital organs are present above than the ischial tuberosity level. Urethra is also present, blood is also present. So we call this system, which is above than the ischial tuberosity, urethra, urinary system, urogenital system. So if I'm dividing this triangle like this, upper triangle, so upper triangle we can say upper triangle as a urogenital triangle, UGT, because urinary and genital system is present there. And posteriorly, below than the ischial tuberosity, we can tell that system as an anorectal system. Anal and rectal system is present into that triangle. So if you divide this straight line here from one ischial tuberosity to other, so you can divide the triangle, upper triangle, lower triangle. Upper triangle, urogenital, lower triangle, anorectal. Very simple. So urinary incontinence, prolapse, sexual issues, they are all the issues related to the upper genital, urogenital triangle. And anorectal means piles, hemorrhoids, you can say that defecation issues, it can be fecal incontinence, they all are issues related to that lower triangle, okay, or anorectal triangle. So this is very important. So diamond, you can divide in right and left also, because right and left, the whole muscles are right and left, and up and down also, urogenital and the anorectal triangle. So very important understanding. After that, you can say that into this system, three muscles are present. So the first is, whenever you will see a female vulva, externally the skin is present. After skin, you remove the skin, that you can say that muscles are present there. So after removing the skin, you can see structures like that. So the muscles are coming from one side to other side, up to down. Now let me give you understanding of this superficial layer, which will be just below the skin and subcutaneous tissues. So, okay, count it as a first muscle coming from the ischial tuberosity and going towards the perineal body. So this was the perineal body. So it's a part, can you see this, how the fibers are going transversely? The fibers arrangements are transverse. Going into the perineal body means perineal body. and part of superficial. So the name of this muscle is very simple. Superficial, because a part of superficial, transverse fibers, so means transverse, going to the perineum, perineum, superficial, transverse, perineum, superficial, transverse, perineum. Very easy name. So what this muscle is doing, coming from one ischial tuberosity, coming to the penile body, merging with the other side of the muscle, and means this coming from here, this is coming from here, so assume this is ischial tuberosity, and coming into the center penile body here. So means merging into the penile body. So superficial transverse perineal right side, superficial transverse perineal left side, merging into the center. So what they are doing? They are providing stability to the ischial tuberosities. So ischial tuberosities are these. The muscles are coming from here and here. So now let me attach it like that. So can you see this and this? So these muscles are, this ischial tuberosities, superficial transverse perineum is pulling this ischial tuberosity into center. This is pulling this into the center. So what will happen to that? This ischial tuberosity will be stabilized. It will be stabilized. Okay. So have you ever, you might be heard about the pubic arch angle, in our studies when we were learning the anatomy, pubic arch angle. So pubic arch angle is always around 90 degree. It should be 90 degree in a female body. So who is maintaining this 90-degree angle? These muscles, superficial transverse perineum. If these muscles are good enough, they have a good tone, they will maintain the 90 degree. If they will be weak, for example, they are loose, weak. So they can't maintain them together. They will go away from each other. Okay, if they will go, because the muscles they will be loose muscle, weak muscle. So means more space area will be increased, more descended muscle, downward descended muscle, loose muscles. When they are loose, they can't pull the walls. So because they don't have strength to pull the walls. So what will happen to the ischial tuberosity? They will fall outward. When they will fall outward, what will happen to the pubic arch angle? That will go outward. So pubic arch angle will be always high. It can be 100 degree, 110 degree, more. It means the superficial transverse perineum muscles are weak. When they are weak, they can't pull them together. So what can happen to the organs? Organs can go for descent, downward pressure over that area. So they are maintaining the stability of the ischial tuberosity. And if they fail to maintain the stability, the pubic arch angle will be high because muscles are weak. If the muscles are tight, for example, muscles are tense, pubic arch angle will be narrow and muscles will be very tense. If the muscles will be tense, you can understand the outlet will be narrow. And if the muscles are weak, outlet will be more bigger. Outward outlet will be more open outlet or narrow outlet. Do we want open outlet or narrow outlet? No. If the narrow outlet, ascending pressure over the organs from downward. If outlet is more bigger, descending pressure. So that is what we don't want. The pressure system will get affected. Not only the pressure system. Understand that spine, SI angle. If this is maintained, so the sacroiliac will be also maintained. But the moment, assume that these muscles are tight. Assume that this is a tensed muscle. The moment the muscles will be tense, can you see SI joint pain at the back? Because muscles are going to narrow down that outlet and increase the inlet. Okay. So again, you can say that it can affect. And if these muscles are weak, and it might be outward. So the moment it is outward, you can say again it is a more spacing. Look, focus over here, focus here. If they can't pull, it will go out. Again, the back pain. Okay, so back pain is always there. If this muscle is tense, back pain. If this muscle is weak, back pain, depending upon where exactly the back pain will be. So this is the muscle of stability. It provides stability to the pelvic cavity. If the muscle is weak or tight, it can create an imbalance, instability, unstable pelvis. Like this, or unstable pelvis can be like this, unstable pelvis. or all the ligament structures which is joined there, they all can become unstable. So this is a muscle major function of primary function of this muscle is stability of what? Ischial tuberosity and whole pelvis. It is very important for the back health. So superficial transverse perineum is the first muscle. Second muscle is, so there's a muscle of stability. Second muscle is going upward. This is the ischium. So from ischium, the muscle is originating and they are going and they are inserting into the male or female sexual organ. So female sexual organ is the clitoris. So muscles are, and inside the clitoris, if you see this cross section of the clitoris or what we say is a penis, I want to show you something. But just be with me. I want to show you something. Okay, I'm sorry, I don't have that image. Inside the sexual organ, we have a cavernosas. Cavernosas are going to get filled up with the blood during the erection. So those kind of erectile tissues are present inside that structure. And we call them as a cavernosa. So just be, sorry. Okay. So this muscle is coming from the ischial tuberosity, from ischial rami, pubic rami, keep going on, ischial rami specifically, and they will insert into that sexual organ, means cavernosal organs. So the name of this muscle is ischio, coming from ischium, so ischio cavernosa, IC, ischio cavernosus muscle. Primary function of this muscle is helping that blood going into the sexual organ. So whenever helping into erection. So this muscle is going to work as a cuff, because just behind this, that arteries, penile arteries are present. If this is the muscle, just below them, this is the penile artery. So the more strong this muscle will be, it will create a compression, the better pumping it can create over that cavernous, this arteries. So more blood can go towards the sexual organs and more erection can be happen. So erection is happening is because of this muscle function, ischiocavernosa. Is going from ischium to the cavernosa, and just below that the arteries are going. So it's going to create a pump, create this kind of pumping, like a calf muscle is doing the pumping. It will help into facilitating the blood movement towards that sexual organs and facilitate the erection. So whenever erectile dysfunction is there, so this muscle can be weak in male. Okay, whenever female don't have this kind of arousals, they have a desire to have sex, but they don't have arousals, so they don't feel orgasm. So this muscle can be weak. Ischiocavernosus, its one and only function is sexual. Ischiocavernosa, coming from ischium, going to the cavernosa. What is the cavernosa? Sexual organ part. After that, the third muscle is, the muscle is coming from, so this is the one side of ischiocavernosus, same way we have a other side of ischiocavernosus. IC muscle we are calling it. From down, one muscle is coming from penile body and going on the sides of the vaginal canal and urethra and going and merging into the cavernosa again. What is the cavernosa? Sexual organ. It can be clitoris part of a female and penile part of a male. Cavernosas are present into that part. So on that sides. So this is the name of this muscle. And another thing is, if you have seen the clitoris of a female or even male also, we have a bulb. That is very important organ. So this is the clitoris. So these are the legs of clitoris. The clitoris is not like a small P shape. It is large, big. So this is the life size of that clitoris. So this is the clitoris. And this is how it is situated in a female body, like that. And on the top of this clitoral legs, this ischiocavernosus muscle is going on the top of the clitoris leg. So in this one, you can see that this is the ischiocavernosus muscle, and on the top of the clitoris is going on. So same way, the clitoris has the legs, on the top of that ischiocavernosus is going, and it has a bulb. And on the top of that, bulbocavernosus muscle is going from down to up. Bulbo going into the cavernosa, means sexual organ. So that muscle is inserted into the body of that clitoris. bulbocavernosus. So this muscle is very important for maintaining that arousal, maintaining that erection in a male, because male don't have kind of two bulbocavernosus. It's kind of merged bulbocavernosus. It's one penis. So one penis, the base of the penis, this muscle is kind of attached, compressing around the whole penis. So this muscle is very important for male for sustaining the erection for longer time period. Some males have this complaint that I can't sustain erection. So when they can't sustain erection, the issue can be this muscle. You can say, let me just erase it. Okay, sorry. Shall I stop it and delete it and then what? Okay. Yes. Can you see now? So this is the bulbocavernosus in a female, because we have two opening. Male don't have two opening; they have only one penis. So this is a change between male and female. This bulbo is attached with the bulb of the penis. So lower part of the penis and kind of as a ring. So the more stronger this bulbocavernosus muscle in the male, the more sustained erection will be there in their life. So erection will be sustained for a longer time period. Whenever they can't sustain erection, it means bulbocavernosus muscle can be weak, because bulbocavernosus muscle is working as a ring at the base of the penis. The more strong this ring is, more better compression it can create over the veins, and they cannot take the blood back towards the heart. It is preventing the venous return. So more stronger bulbocavernosus is required for sustaining the erection in a male case. So that is again and these more stronger muscles are helpful for ejaculatory force when the penis has to ejaculate and the sperm has to go. So more stronger muscles, more better ejaculatory force, more stronger muscles, more better erection, more stronger muscles, more better emptying of the urethra. Urine can start, everything, semen can come out completely from the urethra, because muscle is strong at the base of the penis. It can compress very strongly. So this muscle has a very important role. The name of this muscle is bulbocavernosus. It is helping into reproductive system in a male life, even in a female also. Around the urethra outside it is, around the vagina outside it is. If these muscles are tight, you can't go inside. You can't, the female can't conceive, penis can't go. So, it can give her this kind of issues. These muscles is working as a opener and closer around the in a female body, around the urethra and around the vagina, and it is helping into that helping into the sexual action also in a female body, because having intercourse is also a part of sexual functioning. This muscle is attached with this clitoris, so the clitoris is also we don't want tight muscles, we don't want very loose muscles. We want a good muscles which has a good functioning, and at the base of that, just below that, the bulb of clitoris is there. So it has a sexual role and opening and closing role around the urethra and that, you can say, vagina. It's a door around the vagina and around the urethra. If these muscles will be tight, you can't go inside the vagina, or might be urination pain can be also there. Same way, these muscles are tight in a male, urination pain can be there, and ejaculatory issues can be there, ejaculatory pain can be there. Okay. If these muscles are tight during the childbirth, you can say that episiotomy, they are doing, perineal tears are happening. If these muscles are tight, then only they are doing episiotomy. So the baby can't come outside. So this muscle should be relaxed when the baby is coming out. It's a door around the vagina. So this is the third muscle, bulbocavernosus, which is working as a door as well as an opening and closing. Outer downward, we have another muscle, external anal sphincteric muscles which is sphincteric around the vagina, around the anus. So they are maintaining the continence around the anus. So they are also very important. If these muscles are tight, defecation issues, defecation pain. If these muscles are loose, leakage issues that can happen. So this is a sphincter, opening and closing. So its action is a sphincteric action. Same way, let me just open it. So this was the first layer. How many muscles are there in first layer? 4 muscles. Superficial transverse perineae, ischiocavernosus, bulbocavernosus, and as well as uh, what we say external anal sphincteric muscle. These are the 4 muscles present in this area, superficial layer. And this is supplied by pudendal nerve. This is the pudendal nerve which is supplying that area, coming from S2, S3, S4. Okay. And after that, middle layer, if you just remove the superficial layer, then that you can say this part of structure will be present, and this is a middle layer. This is a superficial bulbo this, and remove it, you can see like that, middle layer of the pelvic floor. So into middle layer, downward, we don't have middle layer because downward part is still completely covered by external anal sphincter, 3 centimeter long is covered by that muscle only. So we don't have any muscles lower part into anorectal triangle. Up urogenital triangle, we have a middle layer present. So into this middle layer, how many muscles are present? So now let me show you. You can see this image. So one is just below than the superficial transverse perineae. One muscle is coming same way, same orientation from ischial tuberosity, same fibers transversely into the perineal body, same muscle, but deeper layer. So we call it as a deep transverse perineal muscle. Okay, that's a sister of the superficial transverse because we need more stability to the pelvis. We can't rely only on to one muscle. We need more stronger base. And this muscle is providing the base to that. So this is the deep transverse perineal muscle. So now it's not only one muscle is responsible, another muscle is strong, creating that stability, stabilizing that ischial tuberosity into the center and perineal body also into the center. Okay. So this is a deep transverse perineal. So superficial transverse perineal, deep transverse, same function, stability of the pelvic bone. So that is the one muscle. And after that, you can say from the perineal body, one muscle is encircling the vagina and the fibers are going and they are going merging around the urethra. So these muscles are, you can say, uretrovaginalis sphincteric muscle. Uretrovaginalis, from going into the urethra, coming from the vagina. So uretrovaginalis sphincters. So whenever opening and closing around the vagina, so you want to insert the catheter inside the, you can say, through the urethra. So this muscle has to relax. Then only catheter can go inside. When you are urinating, this muscle should be relaxed. Then only urine can come out. If these muscles are tight, urination can be painful. If these muscles are tight, inserting inside the vagina can be painful. So means insertion, you can't go inside. Outside might be relaxed, but you can't go inside. Dilation can't happen. So these are the muscles for dilation, which is responsible whenever you are trying to go inside. Muscles around the door when you are going inside. Dilation. So uretrovaginalis muscle, sphincters. Next muscle was ischiocavernosus superficially. Now downward, the same way from the ischium, muscle is coming and they are going into the urethra. And they are calling them as a urethral compressor muscles because muscles responsibility is compressing the urethra, maintaining the continence. So whenever patient is having urine leakage, this muscle is that main responsible muscle, which might be weak. And if the patient is having urination pain or difficulty into urination, this muscle can be tight. Okay, this can be one of the reason why the urination pain is there. Urethral compressors on middle layer. So you can see the muscle is coming from the vagina, downward part. So this is the vagina, this is urethra. Uretrovaginal compressor, and what muscle is coming from the side, compressor urethra. They are merging together and doing encircling around the whole urethra. So 80% of urethra is covered by these two muscles. So they are very important muscles for maintaining the continence around that bladder. So urine can't come out. Urethra will be compressed due to these muscles on the sides, urethral compressor muscles. So this is the second layer. And second layer is responsible for stability and responsible for the dilation around the vagina, responsible for the dilation around the urethra and the contractions around the vagina and contraction around the urethra. It is working as a sphincter. Okay, so that is the second muscle. And the second layer and deeper layer is this one, levator ani. So when we talk about levator ani, deeper layer, so this is a pubic part. So from pubic to coccyx, one part of the muscle, pubococcygeus. Then the side we have a ilium, and going towards the coccyx, iliococcygeus, and ischium to coccyx, ischiococcygis. This way, we have three layers of this muscle: pubococcygeus, iliococcygeus, and ischiococcygis. These are the three parts of the deeper layer, and they are forming the complete floor of this pelvis, and two accessory muscles are present. One is obturator internus, one is piriformis. Anteriorly obturator internus, posteriorly piriformis. And the downward inferior, we are having this pelvic floor. And again, this pubococcygeus is subdivided into different part: around the urethra, pubourethralis; around the vagina, pubovaginalis; around the perineum, puboperinealis; around the anus, puboanalis; around the rectum, puborectalis; and then pubococcygeus. So this way, altogether, deeper layer has three main part: pubococcygeus, iliococcygeus, ischiococcygis, and pubo has further five parts. So altogether, pelvic floor muscle has 15 muscles, 4 outside, 3 inside, and 3 more inside. So 4, 3, 3 is 10. And then pubococcygeus is further divided into 5 parts. So 15 paired muscle, 15 right and 15 left. So altogether 30 muscles are present into pelvic floor. And every muscle is doing its different functioning. So this pubococcygeus, pubovaginalis, pubourethralis, what they are doing? They are pulling the organs upward. So they're closing that urethra, closing that vagina, closing that anus. So stool, urine, organs should not fall down. There should be always upward movement. So this is that pubococcygeus behavior, action. So ischiococcygis, superficial transverse, deep transverse, they are pulling the ischium together. So kind of inward movement. And sphincters are creating a closing around that organs. So sphincteric action. So every muscle is doing a different action into the body. So now let me show you this. The function of the pelvic floor, they are supporting the organs. You can understand now. Every organ is supported by the deeper levator ani muscle. They are providing the stability. Yes, superficial deep transverse perineal, ischio-coccygeal muscle, they are providing stability. Sphincteric, yes, that's all these muscles around the urethra, vagina, anus, they are opening and closing. So they are using as a sphincteric action. Circulatory, they are helping into the venous return. Sexual action, they are helping into the sexual. So if the muscles are good, they are having good tone, they will maintain all these functions, even including the back health and the core pressure, everything will be maintained. But if the tone of the muscle will become high, the muscle will become hypertone. So muscle around the urethra is hypertone, urination will be difficulty, can't pass urine because muscles are tight, can't defecate, can't pass stool because muscles around the anus is tight. The can't insert something inside the vagina because muscles around that area is spasmodic. So whenever muscles are tight, they can give you difficulty with their functioning, difficulty of passing through that canals, passing through the urethra, passing through the vagina, passing through the anus, and even the back health issues. And upward pressure will be always high. So hypertoned muscle means more pelvic congestion, more force and pressure, upward pressure, and ascending diaphragm, and not relaxing diaphragm, and not relaxing during the urination, defecation, and sexual activities as well. Even during the babies coming outside, that can be also difficult for the female. So muscles can become hypertoned. When they will be hypertoned, they will not allow you to pass through. So defecation, urination, or those kind of sexual pain, they can be that primary issue of a person. If muscle will lose its tone, so in that case, they will fail to create a compression. fail to hold urine, fail to hold gas, fail to hold stool, fail to hold organs. So they can start descending downward, or fail to create a compression, or might be fail to pull that bones together. So pelvic instability issues can be also happen. So we don't want hypertone muscle. We don't want hypotone muscle. We want a good tone muscle. So that's how pelvic floor can be three type of issues. You can see three type of issues into the pelvic floor: hypertoned pelvic floor, hypotoned pelvic floor, and mixed pelvic floor. One side of the pelvic floor is hypertoned, one side of the pelvic floor is hypotoned. One upper part is hypertoned, lower part is hypertoned. So it can be mixed pelvic floor dysfunctions. So this can be the different types of as per the properties, or it can be functional dysfunction, uh, sphincteric dysfunction, supportive dysfunction, stability dysfunction, whatever function is missed, you can use that as a dysfunction of that area. So there can be different type of issues with the pelvic floor. Okay. So now these are the function. What is a good pelvic floor? The good pelvic floor which can maintain the good tone. We don't want high tone and we don't want low tone. We want good tone. Muscle which can contract good, which can completely let it go, which can activate the right time and which can relax at the right time. That are the good pelvic floor. We don't want too much tight pelvic floor is a hypertonous pelvic floor. Too much loose pelvic floor is a hypotone pelvic floor. Okay, or you can say hypotone, mixed, or sometimes it can be neurological. Nerves, pudendal nerve, or the nerves we supply that muscles, that areas can be also, issues with that, neurological dysfunctions. Take a screenshot of this: functional dysfunction, sphincteric dysfunction, stability dysfunction, sexual dysfunction. If someone has a low back pain, so that is coming under the stability dysfunction of the pelvis. Sacroiliac joint dysfunction, coccydynia, pelvic girdle pain, poor posture, core control, dyspareunia, vaginismus, vulvodynia, rectal dysfunction, premature ejaculation. These are the issues which you can treat after getting qualified, getting skilled into pelvic floor. Circulatory dysfunctions, varicose vein of the pelvic, vulva, swelling, edema, heaviness, aching, pelvic congestion, pelvic organ prolapse, bladder, bowel, menstrual uterine pain, IBS, pudendal neuralgia. This is all issues where you can help after getting yourself trained into that issues. Take a screenshot of this slide. It's very important. Functioning of the pelvic floor and where we have to focus and which cases we can sort. These are two important scales which is developed by me, and this is now published also. So this is the it's very good scale. You please go through that, and how to read it. We will, if you'll come for level 2, might be online learning program for detail. We will go for more deeper. That is a part of assessment. We will teach you. And this is another scale for checking the strength of the pelvic floor. Relaxation and strength. This is a scale for relaxation, and this is the scale for contraction. Both done by me. Now, this is the treatment. I can't tell you everything, but today in this session, if any of your patient, they have a pain into the area, you find that their muscles are tight. So whenever the muscles are tight, these can be the things which you can help them. Heat therapy, cold therapy, TENS, electrical stimulation, some kind of massage, biofeedback, some mobilizations, trigger point release techniques we can do around the pelvic. And if the pelvic floor is weak, anything which can improve the blood circulation, which can improve the muscle activation, contraction, you can use IFT, ultrasound, you can use you can say, kind of this kind of things are going to create an activation. And next is very important is Kegel. Now, where to do Kegel? What is Kegel? Kegel means create a contractions. Hold it for 10 seconds. Now, where you can hold it for 10 seconds. Can you do Kegel when the muscles are already hypertoned? In case of hypertonus, we can't go for Kegel. In those cases, we have to go for reverse Kegel, reverse the Kegel. Instead of creating contraction and hold, create a relaxation and let it go. Don't hold, let it go. So imagine you are urinating and feel urine flowing out. Inhale air from nose, feel it in your abdomen, feel air is into the pelvic area and coming out from your urethra, your vagina, and your anal canal. Very important to feel that. Imagine your urethra, vagina, or anus has a curtain and try to open the curtain. Imagine release of your gas coming out. So feel that relaxation. So do not go for hold. You have to feel the relaxation. That is the reverse the Kegel. Okay, don't hold the breath. Sit in a comfortable position. And these are the simple exercise. Whenever structure is tight, you can always give these kind of stretching positions to your patient. It will help them. And whenever the structure is weak, like urine leakage is there, stool leakage is there, whenever structure is weak and prolapse is there, so Kegel is always, which you can tell them. So try to squeeze your urethra, hold your urine, hold your gas, hold, and try to maintain as per your capacity. Try to hold it for 1 minute, 2 minutes, 1 second, 2 second, 3 second, and maximum, from minimum to maximum capacity, try to increase. So this is a Kegel. So if the muscles are tight, focus on inhale and reverse Kegel, relaxation. You have to follow the relaxation protocol. If the muscles are weak, focus on exhale, unloading, and the focus on contracting, activating and contracting. So this is the message for me to all of you. Any back pain issues, so in that case, please check the pelvic floor. Ask them, ask them questions like, do you have, are you a mother? What type of childbirth you had? It can be perineal tear, scar, which can be pulling that superficial deep transverse perineal, creating tension into that, which is pulling the sacrum anteriorly, which is changing that whole pressure around the core. So that was my simple basic understanding about the pelvic floor. Because Dr. Meena madam was telling that let's do this session for our Malaysian therapist, it might help them. So thank you so much. We did it today. And thank you, Meena madam, for arranging this session. Thank you everyone for joining me. And any more understanding what is the Kegel, what is reverse Kegel into detail, if you want to understand, you can go to my YouTube link. I will share the video with Madam Meena. She will put that in the group also. You guys can, that's there again, 2 hours of videos. Go through that, practice that, and help your patients. Thank you so much, everyone, for joining me. Thank you, Madam Meena.
Thank you.
Thank you very much.
Any question we can discuss? In vaginismus, is it necessary means hypertone muscle, and in the case of treating this condition other than businesses? Dear, this is a kind of vaginismus means relaxation. You have to relax the pelvic floor. So there is so many different techniques I can't teach here, but yes, inhale, you have to focus. Stretching exercise, which I told you, you have to focus and don't hold, try to relax that area. And pain modalities also you guys can use. Yes, that's a hypertone mind or brain or body, both can happen. May I know, can strengthening pelvic floor muscle help in reducing pubic symphysis pain during pregnancy? Yes, it is very, very important. That's why we should keep doing the Kegel during the pregnancy. Thank you so much, everyone, for joining me. Any question, and we can still address.
Excuse me, doctor.
Yes, dear.
Okay, doctor, how about performing Kegel exercise during functional activities? That means during climbing up the stairs. Is it proven to be helpful or otherwise?
Sorry. Can you repeat your question?
Okay, how about performing Kegel exercise during functional activities? For example, during climbing up the stairs or coughing and everything.
Yeah, it
Is
is
it
very
proven?
important because a pelvic floor should always have this kind of good tone whenever we are doing functional activities. That's our end result and goal. But if someone's pelvic floor is already weak, they don't have any action. In that case, we can't tell. So that's why you go through the scale first, the scale which I told you to take a screenshot. That is going to give you clarity. Depending upon if the patient is 1+, they can't even have a contraction, minor contraction, they can't do Kegel. And in that case, they can't go for a functional Kegel because your muscles are not individually able to create an action. How they will be work as a group muscle, they can't. But might be that group muscles like squeezing that there are synergetic movements sometimes, like activating your core. Whenever you're activating your core, pelvic floor can also get activated. Whenever you're squeezing your toes, pelvic floor can get squeezed. Whenever you're activating your transverse abdominis, pelvic floor can get activated. Whenever you are squeezing your glutes, pelvic floor can be activated. So it is always good. And these are the functional movement. You are doing something and some other, I am pelvic floor and I am weak. But you are my neighbor. You are strong. If you are strong, you activate yourself and might be my fibers will start getting activated. So whenever the muscles are completely weak, we should not, give the patient functional Kegel, or cannot give them this command that you squeeze the pelvic floor when you're doing the functional activities, because muscles are weak. So let's train the muscles individually without functional activities. Let activate them. Let's increase their endurance slowly. Let's increase their power of squeeze for more time. Let's increase their repetition and their strength. When the strength will be increased, then slowly we will use them into functional activities. If they don't have strength, do not use them in functional activity. They need support because they don't have strength. So they need support. So no, we can't use them in functional activity if they are weak. But if they are strong, our pelvic is good. So yeah, we can then this is a basic kind of training where we have to start using the functional activity for further activation of the more recruitment of the number fibers, voluntary action or involuntary action. Both are very important. So I think this question I can answer you more into detailed sessions when we will learn, because I can't give you half cook information. You might don't understand. But yes, if they are active, you can add functional activity. If pelvic floor is not active, don't add functional activities. Okay? But you can recruit with the synergetic movement. Hi, Dr. Sunita. Thank you for this. I hope I answered your question, dear. Did you
Yes,
understand?
doctor. Thank you.
Yeah,
Thank
if
you
they
for
are
the
active,
explanation.
if they are already active, you can recruit with the functional activity. If they are not active, do not recruit with the functional activities.
Okay, thank you.
Thank you, dear. Thank you for this insightful section. So good to refresh all that I have learned 16 years ago. Oh, Dr. Karthini. Wow. I have learned 16 years ago. I do totally agree that anatomy knowledge must be strong in order to treat our patient right. Thank you. Doctor, if there is a urine leakage even after complete urination when jumping on trampoline, is that a symptoms of weak pelvic floor? Yes, that is a symptom of weak pelvic floor. That person is suffering from stress incontinence. The incontinence, there's a different type of incontinence issues, and this person is suffering from weak pelvic floor. Muscles are weak. Fast twitch muscle contractions are not there. Can you share the record of this session? Definitely, I will share the record of this session. Thank you so much, everyone. Thank you, Dr. Harini. Thank you.
I'm Sashi, Sunita. How are you?
Hi, Shashi. Where are you? Let me just unmute myself.
Oh, fine. Congratulations
Thank
for
you.
the scale. Yeah, fantastic.
Thank
It
you.
appears as Harini because of my daughter's this one.
Thank you so
It's
much.
yeah.
Thank you.
Hope everything is
It was
going
a
on
hard
well.
work of many years, and your support, Meena madam, was always there. She's always helping me on everything.
Fantastic. You have the flair.
Thank you.
Hi, Sunita. I'm Krishna here. How are you?
Hi, Krishna ma'am. How are you? I'm good.
I'm good.
I'm happy to have you.
Oh, nice seeing you.
Same here. I hope today's I tried to give a little bit about pelvic floor.
Hello.
Hi, Meena ma'am.
Hi. Thank you for joining, Krishna.
Thank
Thank
you.
you. Thank you,
Thank you,
Dr.
Krishna. Thank
Sunita.
you.
Thank you so much.
Thank you.
Very good session.
Thank you, Meena ma'am. Thank you so much for your unconditional support in my life. Thank you. Really obliged. Lucky to have you. Thank you, everyone, for joining me and Madam Meena. She's the bridge. And yes, we are planning our workshop in Malaysia. Very soon we'll decide the dates. Anyone of you, please join us. Thank you, Meena ma'am. You want to say something?
No,
Okay.
thank you so much for
Thank you.
arranging so much of your time spent, and you explained so well. Thank you.
Thank you.
Looking forward
Yeah.
to meeting you. Yes.
In April. Bye. Bye, everyone.
Bye. Bye.